This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, April 29th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. The aviation industry is being hit hard by the coronavirus pandemic. Travel bans and stay-at-home restrictions are taking their toll on global airlines. European aviation giant Airbus on Wednesday said the industry is in a grave crisis and that it will take time to restore people's confidence in air travel. Airbus reported its first quarter results, saying it lost $522 million as it put thousands of workers on furlough and delivered 40 fewer aircraft than the same period last year. Here's the latest on COVID-19. Reuters says there are over 3 million worldwide cases of the coronavirus, with more than 216,000 global deaths, but over 880,000 people have recovered from the deadly disease. The United States still leads the world in confirmed infections, with more than 1 million and over 58,000 fatalities, according to Reuters. Now to Africa, where the COVID-19 outbreak is derailing the July 1st start date for the African Free Trade Agreement, according to Mkele Mene, Secretary General of the African Continental Free Trade Area. Mene did not say when a new implementation date would be announced. The International Monetary Fund says it has approved $3.4 billion in emergency funding for Nigeria so it can boost its response to the coronavirus outbreak. The pandemic has triggered a steep decline in oil prices and exports, and Malawi is set to launch an emergency cash transfer program intended to assist 1 million people and small businesses affected by COVID-19. President Peter Mutharika says eligible households will receive a $40 cash transfer beginning in May. Human Rights Watch is warning that children could be the main victims of the COVID-19 pandemic, despite the fact that the disease is affecting mostly older people. The ongoing global economic crisis means that many families in developing countries may pull their children out of school and force them into work. Rates of child abuse and child marriage rises during prolonged economic downturns, while there are also fears that children will miss out on education and immunization programs. Henry Ridgewell has that report.
Empty classrooms being disinfected in Wuhan, China, where the coronavirus pandemic began. It's estimated that globally 1.5 billion children are missing school. Human Rights Watch says the outbreak is having myriad impacts on young people.
More and more children are going to be left without parents. And we've seen from the Ebola crisis, for example, the HIV epidemic in sub-Saharan Africa, that when children are orphaned, they become much more vulnerable to sex trafficking, to child labor, and other forms of exploitation.
A recent report from the International Labour Organization warned 200 million people could lose their jobs as a result of the pandemic.
As parents lose their employment, especially in developing countries, we often see more and more children pushed into child labor to try and help families just meet their basic needs. And correspondingly, there's also a trend towards early and child marriage, with girls feeling the pressure to marry to get out of the house and relieve the pressure on their parents.
It is the most vulnerable who feel the effects first. These children live on the streets of Dakar, Senegal. Life is getting even tougher under lockdown.
Before the coronavirus, we were asking for food from people. But with the disease, everyone started to be worried and to take safety measures. They stopped giving us food.
In rich countries, poorer children are missing out on school lunches, often their one big meal of the day. This was the line recently outside a school in New York, which has begun serving food to all members of the local community.
It's a bit tough right now, considering we don't really have work to get food. So we have to make do what we have.
With the country in lockdown, activists in Russia report a big spike in domestic violence, a pattern repeated in many countries around the world.
As parents become anxious about their health, about their finances, about their jobs, and tensions rise as people are sort of together 24/7, the risk of violence really escalates.
There are also concerns that children are missing out on vital immunization programs as health systems prioritize coronavirus patients. Human Rights Watch is urging governments to put children at the center of their coronavirus response policies, with greater efforts to expand access to education and to provide economic assistance to vulnerable families. Henry Ridgewell for VOA News, London.
The Ethiopian community here in Washington, D.C. area is mourning the loss of a mother who died from coronavirus earlier this month, shortly after giving birth. The woman never got to see her newborn baby. Reporter Sion Girma attended the funeral in Virginia, and Salem Solomon has the story.
At the Wilkes Street Cemetery complex in Virginia, mourners gathered to lay Wagen Debela's body to rest. Her husband, Yilma Asfal, collapsed on the casket, crying out in Amharic.
You didn't see the boy you were looking for. You left your 4 children. And what would I do for them?
Despite his distress, his friends and family were unable to comfort him because of social distancing restrictions. Wagen was 8 months pregnant when she began experiencing COVID symptoms. She died on April 21st, shortly after giving birth to a healthy son. He does not have the disease. Her 17-year-old daughter, Mehret Yilma, said the loss is impossible to process.
I didn't just lose one person. I lost 3. I lost my mother, my sister, and my friend. We were very close. She left without saying goodbye. She taught me the meaning of strength and faith. We are safe because of her prayers night and day.
Mehret Yilma has been thrust into the role of mother, mixing milk formula to feed the baby and taking care of the newborn. She said she takes solace in her new responsibility.
The newborn baby reminds me of my mother. I feel like I'm finding my mother through my siblings. From now on, they're all I have got.
Yilma, 50, and Wagen, 43, won the diversity visa lottery to come to the United States 10 years ago. A school bus driver for Montgomery County, Maryland, he says he still cannot accept the loss of his wife.
We have been together for 25 years. She was my childhood friend. She was my childhood partner. She was my advisor, my lead. I don't even know what to say. She loved her children. She was the kind of person who welcomed people with open arms. My sorrow is deep and bitter.
The Washington, D.C. area is home to the largest population of Ethiopians in the U.S., with an estimated 100,000 people living in the region. With Sion Girma, Salem Solomon, VOA News, Washington.
Uganda's healthcare workers say they are seeing some success in hospital wards as they fight the fast-spreading coronavirus. Uganda has confirmed 79 infections, 49 recoveries, and so far no deaths. But outside of Uganda's hospitals, healthcare workers face stigma. Halima Athumani reports from Kampala.
The high-risk COVID-19 ward at Uganda's Malawi National Referral Hospital was filled to capacity in the past month. But the hospital says recoveries have kept pace with and even surpassed the rate of confirmed coronavirus infections.
We said, okay, let's see how this virus will kill people if we maintain them on their normal drugs. If they are hypertensive, we treat hypertension, we treat diabetes, we treat ulcers, we treat all forms of diseases. And I think that was part of our success.
Dr. Fred Nakwagala says past lessons from Ebola and cholera outbreaks helped prepare them. But he admits COVID-19 poses new challenges, including for healthcare workers.
You remain with that sense of fear, anxiety, and also for you may be strong, but your family where you stay, your community where you live and travel. And there's also the issue of stigma. If you go into a market now and the people in the market, the supermarket know you, they kind of don't want to serve you. They kind of feel like they don't want to associate with you.
Ugandan Health Minister Dr. Jane Ruth Acheng says the only new confirmed cases of coronavirus are coming in from other countries.
Nearly 23 are truck drivers who came either from Kenya or from Tanzania. Within the country, we have not been getting positive cases. And as we draw close to the end of the lockdown, we need to have vital information that will form part of the decisions for lifting the lockdown.
Uganda's lockdown restrictions on movement and gatherings are set to expire or be extended on May 5th. To help make that decision, the Ugandan Health Ministry will conduct a nationwide rapid survey on community transmission, including 20,000 tests for COVID-19 to see if more infections are being missed. Halima Athmani for VOA News, Kampala.
Drones are helping to spread the word on how to prevent the coronavirus infection in the poor rural areas of northern South Africa's Greater Zanin municipality. Local authorities are pioneering the use of this aircraft as a tool to educate people about COVID-19 in the local languages of Sepedi and Songa, while monitoring potential non-adherence hotspots. Marisa de Klerk reports from Johannesburg.
COVID-19 has changed many things in South Africa. Here, in the Greater Zanin municipality of South Africa's northern Limpopo province, the mayor's voice comes from a drone in the sky, warning about the potentially vital virus. With only 3 hospitals in the entire district, extensive coronavirus prevention efforts are needed, says Mayor Maripi Mangena.
We are able to access our people. A drone is a fact that it's not a very common technology that is being used. I think it's part of the 4th industrial revolution. But how we are using it, when it flies, when it hovers above the communities, it fascinates, it intrigues people. People want to listen. People want to hear. What is the message that is being said?
A licensed drone service provider is carrying out the messaging at potential coronavirus hotspots under the direction of the South African Police and with the guidance of the municipality's COVID-19 committee. The Greater Zanin municipality was originally the only jurisdiction willing to use drones from Mutharika Aviation Services, says company managing director Jack Shiluana.
They've got the perception that we're talking about a whole lot of money that you spend in this exercise, and others would probably ask to say, but why don't you provide water? And it is that balancing act, in terms of how much drone technology costs you, but the value that you derive from an exercise such as this one.
Drones are well suited for this purpose in rural areas, especially in Africa, because they provide more value for the money spent, says the head of South Africa's Federation of Unmanned Aircraft Systems, Sam Twala.
In Africa, that's where drones are going to find better use compared to even other areas in the world or other countries in the West, simply because of that particular challenge that we might have. And when it comes to things like your cost, that's where actually drones add much more value, because drones offer that advantage where you can tactically, place your people.
It seems that the spreading of the message about COVID-19 prevention has helped in the Zanin region, says a local journalist.
I believe it helped, and I believe that without the drones broadcasting these messages to the people in the far-off areas, they wouldn't have known.
So far, just one case of coronavirus infection has been reported in the Greater Tsinin municipality. Marisa de Klerk for VOA News, Johannesburg, South Africa.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, a national program in Ghana seeks to support and fund young entrepreneurs. We'll be right back after this break. Welcome back to Africa 54. In the U.S. state of Michigan, the Detroit area is home to one of the largest Muslim populations in America. Some of those Muslims chose to work in the medical field as physicians and are now working the front lines in the COVID-19 pandemic. Here is VOA's Alam Burhanan.
According to a 2017 study called Muslims for American Progress, commissioned by the Institute for Social Policy and Understanding, Muslims comprise about 15% of physicians in Michigan.
Medicine is where you find people the most vulnerable and in need of help.
I love the medical field just because you get to touch people's lives every day and you get to really make a difference.
I'm an immigrant. I came to the United States around 10 years ago, and then I remember I didn't have insurance. My parents didn't have insurance. We went to free clinics, and that from there inspired me to be a doctor.
Many of these doctors are influenced by their families. Muslim immigrants who came to Michigan in the 1960s and 1970s and chose to study medicine as the demand for medical professionals increased.
And there is a meritocracy here, which is the society believes in hard work and merit. And so a lot of doctors came here looking for these opportunities, and there was demand here too.
The wave of Middle Eastern refugees in the 1960s to 70s also contributed to adding more Muslim medical professionals.
In the 1960s, our immigration laws were liberalized, really significantly liberalized, and we put an emphasis in that period on bringing in people who had advanced degrees, people who were highly skilled, and people who were skilled in fields where we had a deficit here in America.
So we can see what the
Among immigrant communities in Detroit, being a doctor is considered prestigious.
Back in our countries where we came from, doctors are at a very high status.
It's a universally understood success track, right? So doctors and engineers, I find in the Middle East, engineers are also respected very much like doctors are.
Upholding a family's legacy is a tradition still held by many young Muslims.
My dad's a physical therapist. That's why I was interested in to go into the pre-health field.
I grew up around that environment, and it really made me attracted to go into that field.
The best thing that you can do, one way to serve, God, right, to serve Allah, is to do service of others.
The 2017 study also cited that Muslim Michiganers comprise more than 7% of dentists, about 7% of podiatrists, and 6% of osteopaths, serving 1.6 million appointments to patients per year, and indirectly supporting close to 40,000 jobs. For Alam Burhanan in Detroit, Michigan, Nova Purwadi, VOA News.
Spain has relaxed what was one of the world's strictest lockdowns, allowing children to go outside now for the first time in more than a month. In this report, narrated by Jonathan Spear, Alfonso Bito in Barcelona looks at a small step that is making a big difference in some young lives.
This was Barcelona 4 weeks ago. The picture now is quite different. Confined without permission to go out for 44 days, children have had to spend their time studying, playing and socializing at home.
And sometimes we go upstairs to the rooftop and we usually find with some other people, but we talk, but with a distance.
Children had been confined at home since March 14, when the Spanish government declared a state of emergency in a bid to slow the coronavirus pandemic. Sunday was a day of joy.
Well, very happy. It's a very sunny day, so it's good too. So, yeah, I'm very happy.
It's a small step toward normalcy. Schools still remain closed with no date set to reopen. Children may be allowed outside now, but a normal life is still something children yearn for.
Be with my friends, go to the school and learn other things.
The number of daily coronavirus deaths in Spain is falling day by day. The April 26th death toll was the lowest since March 18.
The people have responded correctly and listened to what the government says. Now we'll see what the secondary effects are.
Seeing children on the streets is something many in Spain have long awaited. It may be a small step, but it has brought hope that the virus has run its course and that a return to normal life continues. For Alfonso Beato in Barcelona, I'm John Spear, VOA News.
In our tech report, Ghana, through its flagship initiative, the National Entrepreneurship and Innovation Program, is trying to build an ecosystem for young entrepreneurs across the country, with the primary objective of providing integrated national support for startups and funding to enable them to grow and become successful. Africa 54's tech reporter Paul Ndiho sat down with Franklin Owusu Karikari, coordinator of the National Entrepreneurship and Innovation Program in Accra.
The National Entrepreneurship and Innovation Program was set up by the government to become the enabler of the entrepreneurship ecosystem. And it's a flagship policy initiative of the government. The government realized that there was a huge graduate unemployment and youth unemployment in the country. So what was the way out? The way out was to look at how we can quickly and drastically cut down the unemployment challenge that we have in the country. We work with government, we work with the private sector and the various key stakeholders to create the ease of doing business in the country for the young people, for the startups in the country. And within 2 years, we dove into the grounds. We've been able to train about 19,000 young people, startups, small businesses across Ghana, all the 16 regions.
Then how would you respond to some young people that I've met on my trip who said that the government is not doing enough, that the government hasn't really built that environment where they can come together, see their dreams come through, that the government has been slow listening to them?
In every environment, you meet different kinds of people. Some lack access to certain information, and I will accept that not everybody might have been able to access the things that we are doing. I'm just talking about 19,000, and you can talk about over millions of young people. So that is expected. Now the narrative has begun to change. The cultural mindset is changing, where we have an attitude of entitlement that government should provide employment for all of us. Is changing. The dynamics is changing. Young people are beginning to realize that they can do something for themselves. Now we are sending entrepreneurship training down to the high schools. We've set up schools entrepreneurship initiatives right from the high schools. This year, we are rolling up close to 150 schools, high schools in Ghana, and we are forming entrepreneurship and innovation clubs on various high school campuses. Begin to change the paradigm, we shift the paradigm, change the mindset, drum home that we can change the narrative for Ghana.
Let's go back to capital. You said you created programs that support some of these people. Is it a merit-based system where you go through a process or a vetting system, or if you know somebody who knows somebody, you can easily get funding?
Well, somebody say this is Africa, but there are times we need to begin to have some level of confidence in government machineries. What our program does is that when we do the call, the applications come in, and everyone who applies and meets the criteria goes through automatically. So you talked about starting a business and it's failing. What does failure mean in that sense? It wasn't easy because I virtually lost every capital. We were living on my wife's small salary that she was receiving. Life was tough after the business going down the drain, because I learned that when one door closes, another door opens, and it toughens you up to look out for the next opportunity. And what I want to tell young people is that when your business fails, that's a good opportunity for you to backtrack and assess yourself where you went wrong and bounce back again.
How are you able to bounce back and stay afloat?
Most people think that our entire challenge is funding. My next business that I started right away was a business that I didn't need money to start. All that I needed was my idea. So I tell young people, if you have ideas, start with the one that requires the least of capital or no capital, and raise money from there to build the businesses that are more capital intensive.
In your view, what's a startup?
A startup is that one person who has the idea and he's running the business and he's working in the business. When you grow and you become a full-blown businessman and entrepreneur, you don't work in your business, you work on your business. When you are working in your business, it's just like working for any other company. And most startups, you are working virtually because when you are not there, the business is not there. That is a startup. But when you are able to build systems that operate without you, you are no longer a startup. You are a full-blown business.
That was Africa 54 technology reporter Paul Ndiho speaking with Franklin Owusu Karikari, coordinator of the National Entrepreneurship and Innovation Program in Accra, Ghana. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.